A very good morning to you. I'm Howard Feldman. This is the Sunday Synthesis podcast on this morning, the 19th of September, 2021. Well, I thought it would be warmer. It isn't, but I guess spring can be a little bit like that. Either way, it is glorious. Here in Johannesburg, the numbers are down, and I think we are looking quite optimistic. Am I right, Dr. Anton Meyberg? Good morning. How are you?
So lest I give you the go-ahead and say that you're right, because then I'll never hear the end of it and you always think that you're right. So I don't want to say that you're right. I mean, you have been calling it spring since the beginning of August. Let's not kid about that one. Right. And hence we're wearing our jerseys and you're probably wearing gutkers and a whole lot of other things. But anyway, back on that one. Mm-hmm. So things are looking much better at this point in time. There are currently 228 million cases worldwide with 4.6 million deaths and 205 million cases resolved. The United States has 42.8 million cases with 690,000 deaths. India has 33 million cases with 444,000 deaths. South Africa, 2,880,349 cases with 86,116 deaths and 3,286 new cases in the last 24 hours, an 8% test positivity rate. So we're getting nearer to that 5% positivity rate. So it's been called for by the World Health Organization. Gauteng has 2,512 patients in hospital with COVID-19, of which 449 are in ICU and 229 are ventilated. All provincial COVID-19 curves continue to go on the downward trend, with Gauteng and Limpopo definitely having exited the third wave. And a very good point of good news this early in the podcast, my hospital currently has no active COVID patients.
Wow, none. But that none. Between the second and the third wave, did you get to a position where you had no patients?
You know, it's kind of like when a woman is pregnant and they promise they'll never get pregnant again because the 9 months are so bad. You kind of forget. So I actually don't even remember. Like it's all a blur, you know, between the first to the second to the third wave. So I don't remember being as happy as I am now that the fact that we don't have any cases. I don't remember that being one of the actual pros. Yeah.
Look, I certainly don't recall that. So if you don't mind me being a little bit rude, what do you do all day?
I've actually had to relearn how to doctor. I've been looking on this brilliant website. It's called Google. It teaches how to do everything. It's unbelievable.
Right. Otherwise, you could just ask your questions on Facebook, and I'm sure people would answer them, right?
I just don't have Facebook. I might maybe go to Twitter.
No, I don't think you'll get to any. Well, no, but you can learn to trade Bitcoin, right? So let's start looking at some of the questions. A lot of people asking in South Africa about the booster shots, and in fact, where are we with that?
So we're currently everywhere, but we're currently nowhere. We know the fact is that we do want to get the booster shots. We do believe it's mandatory for healthcare workers to get the booster shots, especially now 8 months down the line, having started the vaccinations in February. We do know that it is recommended and required. And as Prof. Shabir Mahdi has said, you not only had the J&J vaccine, any healthcare worker, frontline worker who had it, definitely should get a Pfizer booster at this point in time. We are waiting for the government to sanction it and give the go-ahead for that. That being said, people over the age of 60 will also require boosters at a predetermined time. Once the government gives the go-ahead, don't rush to just go out and get it sort of clandestinely. Wait your turn. You already have got some cover from the vaccinations already, and we're waiting for the booster so that we can get your robust immune response from the actual vaccination.
Right. And should they get one Pfizer? If someone's had the Johnson and they can get the booster shot, let's say a Pfizer, is that one Pfizer or would that be two Pfizers?
So from what we know now, it's one Pfizer. But as I say, we still got to wait for the government to sanction it. So don't go rush ahead and do anything just yet.
Okay, fine. In fact, somebody listening in from Israel asked that question. They said that in Israel, they're already moving to the third booster, to a booster shot for everybody, whilst I think the FDA is saying only for people over 65. What are your thoughts on that?
I have to go with the Israelis on this one. I think that's the correct the path to go. I think it will give a much better immunity and a much better immunogenicity against the mutations, against the Delta variant, and a better uptake of immune response towards the actual virus.
Right. Okay, so let's also start looking at some of the specific questions that we've received. There was a lot of discussion around a company like Discovery saying that it's mandatory for their employees to be vaccinated. A couple of companies have come out and followed suit. I know that many companies are struggling with this, not wanting to impose necessarily anything on anybody, but at the same time concerned about being able to function, protecting their work, their employees, etc. Where are you on all of this?
So I read a very interesting article by Professor Jonathan from the University of Ottawa, who's a professor of healthcare sciences at the University of Ottawa, and his university have made vaccines mandatory for people to become on campus. And he says as follows: you cannot cross the border without a passport. You can't drive a car without a license. You can't cross the street unless you've got a green light. You can't go to a nightclub unless you're 18-year-olds and have a valid identification. And you can't enter private property unless the owner gives you permission. He says a free society is not an anarchic society. If you don't want to be vaccinated, then you have the freedom of choice not to come onto the campus. And I think that summarizes the whole thing. So yes, we have freedom of choice. Does it infringe on your rights? I don't believe it infringes on your rights. I believe it protects everybody around you. But you have the freedom of choice not to be vaccinated, but then you're not allowed to go to certain places.
Right. So what you're saying is that if you want to work for an organization, and that organization has it within their rights, as far as your opinion, it's not a legal opinion.
Yeah, that's my opinion. Yeah. It's their right to
they should be able to say, right, if you're not vaccinated, that's cool, but you can't work for us, or you can't 100%. Come onto,
it's going to be the same as the green pass or the passports and the green cards to get people to go anywhere overseas. If you don't have one of those, you won't be able to enter certain places.
A lot of statistical anomalies around the vaccine, and I see it. I'm always, and following this podcast, I'm going to post the podcast, and then I'm on Twitter. I'm going to be hammered by people sending me information about, well, vaccines don't work because 17% of South Africa has been vaccinated, but 17% of people in hospital have been vaccinated. So how what are you seeing? I mean, you now have no patients, which is the best news at all, but what are you seeing
what we saw towards the end of the third wave and what we've seen overseas in the United States is 95 to 98% of the people being admitted into hospital are the unvaccinated people. The people that are dying overseas are the people who are unvaccinated. So it's as clear as day. If you're unvaccinated, your chances of getting severe disease, critical disease, your chances of dying are much higher proportionally to that of somebody who is vaccinated. And it's just as clear as anything can be.
Right. So there's no, in your mind, not in your mind, in your experience, there's absolutely no discussion around the efficacy of vaccines.
Not at all. There's no doubt about it. The vaccines work. We know that they help prevent severe critical disease. Yes, you do get breakthrough in a very small amount of people. There's no vaccine that's infallible, but it definitely works.
Are there still myths being spread around the vaccine?
Yeah, there are plenty of myths. I mean, the latest myth, the latest myth is a new exciting one, that if you gargle with betadine, now betadine is what they use to clean wounds. It's that brown substance, it's povidone in an iodine solution. If you gargle with betadine, you'll enhance your ACE receptors and you'll be able to clear the coronavirus. Myth number one. The problem with that is the side effects from swallowing the betadine and nausea, vomiting. You can get liver impairment, you can get kidney impairment, coma, and death. So they're only small side effects, but nothing to worry about. The second myth is still the fact that the ivermectin myth is going haywire in the United States, but is being heavily debunked. It's almost like it missed the whole United States for like the whole time it was in South Africa, and now all of a sudden it's kind of made traction there, but it's being debunked completely. And then, of course, the third one still is herd immunity. We know we're not going to reach herd immunity. We're going to reach population effective protection against severe and critical disease. So those are the myths that are going around.
Okay. We have had a number of questions, however, in fact, two particular questions about people who have received vaccines. Number one, from women, can it delay your period? Can it delay a menstrual cycle?
So we've discussed this before, and
Mm.
it's highly unlikely. None of the studies have shown that. There have been a few isolated cases where it does, but it's not one of the known or documented side effects of the vaccine.
Okay, and the other one is people asking about shingles, a high incidence of shingles as of late. Could this at all be connected to the vaccine?
So once again, also, we have discussed this one before as well, that there are a certain amount of people that have got shingles post the second vaccine. And is it related to the vaccine? Unlikely. Is it related to the fact that people are immune suppressed, the immunity is down? More likely.
Right. It was interesting because my son in Israel had the second vaccine and he got shingles, and something he's never had before. But as you said, it could be, there could be other reasons.
People are run down. People are mentally, emotionally, physiologically run down. And there's enough reasons for people to get sick from other viruses and other things, right, for many other reasons.
Well, this is what I wanted to talk about. And I think this is quite, to me, an absolutely critical discussion. Is my observation has been, and I started doing some research on this, that people are in a very, very bad way emotionally. And a lot of business leaders that I've spoken to in the last couple of weeks are concerned that following the pandemic, we're going to see almost a tsunami of mental health concerns, because while people are in the middle of fighting a fire or surviving something, they're actively fighting it, but afterwards they kind of break down. And I'm trying to show you some numbers. Some of the numbers that I found is that within the UK, the incidence of depression have doubled from 10 to 20%. In the United States, it's increased 4 times, from 11 to 42%. And that it's even a greater impact on young adults. 18 to 24-year-olds have increased to 56.2% in the United States, reporting symptoms of anxiety and depression. And we of course now know that this impacts not only on our mood, but on our physical health as well. Can you talk to us about this pandemic and mental health from a medical perspective? What have you seen?
Well, I mean, it makes perfect sense. I mean, there's going to be a huge amount of post-traumatic stress, not only in your frontline healthcare workers, but in general people who've had the virus, or people who've been in lockdown, or people who've been isolated. We've taken away the functionality of normality in life, where people who are able to socialize, people who are able to go out, are now fragmented into a little case where they've got to stay indoors and they've got to be in their own company throughout the day. And that's not fun. For some time period, for a short period of time, it's just, I'm surprised you haven't jumped up onto yet. But I suppose you'd have to walk up the stairs, and that's exercise, and that's a whole lot of things. So we wouldn't go that way. So
that is not sensitive.
Be working. So, the point of the matter is, that psychiatry is not my forte. The point is, one of the long consequences of COVID is the psychological, psychiatric point, whether it's a neurological or a psychiatric part. And if you didn't have COVID, even if you're just, as I said, locked down or isolated, we've seen even in South Africa, the numbers of young people that are depressed, that are being admitted to hospital with parasuicides or with severe depression, or with eating disorders, or with other somatic manifestations of headaches and other neurological problems, is greatly doubling, tripling, and increasing as we're going along. And we're going to see this as we go along, especially now when you get almost like a taste of normality again. So now when things are quieting down, we're over the third peak, and we know that the fourth wave is coming, and we're hoping it won't if we can get more vaccinations up, and we're hoping that won't happen. But if the fourth wave comes, it's going to take that major plateau we're at and bring it down again. Going into the December holidays, people want to relax, people want to go to the beach. If that's taken away from us again, it's going to cause, as you said, a tsunami of depression, of psychological problems, of long-term problems that we're going to be dealing with for many years down the line.
So it's interesting, because if I can be vulnerable for a moment, I found that as of late, I battled more with worrying about people that are dealing with things and its impacts on me. And I've been very active throughout the COVID pandemic, doing things like these podcasts and other talks and educating people. But I found now that it's a little bit easier. I'm finding it quite hard sometimes. And I think to myself, wow, like this is a bit overwhelming, given, and, you know, just assisting people and seeing the struggles and hearing almost every day from people that are not great. And I found that is impacting on me now, whereas I don't think that it did in the height of the waves. So I can see that within my own
it makes
response.
sense. It does make sense, because it's the same as the hustle and bustle of getting the year done, carrying on, getting all your deals closed, getting all your mergers signed, all your acquisitions, everything done and sorted. So by the end of November, come the beginning of December, you can go on holiday. And we all know within that first 2 weeks of the holiday, people get sick. People are more depressed. People just need to tone down because they've been at such a high for such a long period of time that their body almost goes into this flight and fight reaction where they can actually just relax, and then your immunity drops and you actually get sick, and you actually get sort of a somatic manifestation of your body being overtaken by other things which you didn't have before, because you're in such a high revved situation and a high stimulating situation where you didn't have to worry about those type of things.
So how's this manifested for you? Because now you're in a bit of a lull to some extent in terms of fighting to save lives, living an completely insane life, and now it's a little bit easier. Has this impacted on you?
So it has. I mean, you go through a period of, as I say, of this high intensity, this high stimulation, this period where you don't get sleep, where you don't get time to relax, and all of a sudden, now things slow down, especially with the holidays, the Jewish holidays now, you almost get a time to relax. And all of a sudden you get body aches and body manifestations that you didn't have before. And this is happening now. And this is happening to a lot of people that are going through this type of situation, because it's just time for the body to actually try and recover throughout this. And once again, it's definitely a psychological aspect to it, because your mind now gets a chance to actually breathe and realize what you've actually been through. The beauty of human nature is that your mind also suppresses in a lot of the information so that you don't have to sort of suffer through it.
Right. So do you recommend people get help at a time like this? Because during it, it's almost difficult to do.
I do believe so. I do believe that psychological help is mandatory, and you need someone to speak to. You need someone to buff your ideas off. You need a third party that's not involved and that can actually help you get those sort of thoughts processed so that you can understand what you've been through and how to have a pathway forward.
Right. What's interesting to me as well, or not interesting, quite significant, is the impact also on people with long COVID, because we've seen a lot of people, and certainly a lot of people that I've spoken to, are very, very worn down by long COVID, and that's also having this emotional impact, almost bordering on depression.
Right. And as I say, once again, one of the manifestations of long COVID is neurological or psychocognitive or psychoneurological manifestations. And that is the fatigue, the headaches, the depression, all that type of thing. And they've actually now opened up a long COVID center at Groote Schuur. I think that's the first in the country. So they've started now. They're going to open up clinics for long COVID, which are going to be necessary. And as we go along further with this virus, we're going to see more and more people needing the help of these long clinics.
Are you seeing that the people that you're seeing with long COVID, is there generally a trend? In other words, are you saying, right, this is the type of medication you need, or is each long COVID sufferer presenting in a bit of a different way and you needing a unique approach?
Yeah, I think you need a unique approach. I think everyone's different. I mean, remember that I'm a pulmonologist, so I'm seeing a lot more respiratory related type of issues due to long COVID. Albeit that those people with respiratory issues have got a lot of psychological issues due to the fact that they couldn't breathe, due to the fact they can't breathe, and that plays a major impact. So the two do marry each other, but there are a lot of small little issues that intertwine with each other that need to be addressed, and there's no single sort of a combination of X plus Y will give you Z. You need X plus Y plus A plus C plus D to add to all these things, and you look at the whole thing as a whole, not just as a single entity.
And in terms of headaches and neurologic, psychiatric, neurological type of approaches, when does somebody need to go and seek a professional, an expert opinion on this?
Look, if this has been 6 weeks now down the line after you've had COVID and you're still getting headaches and you're still getting neurological things, or you're still getting any of these manifestations, and you need to see somebody, you need to get help, because this can carry on for a long time, and you need to address the issues, whether you're treating it symptomatically or you're treating it psychologically or you're treating it both. You need to treat both of them. They're all real and they all need to be addressed.
Can you tell us a little bit about the Novavex vaccine?
So the Novavex vaccine was manufactured in the United Kingdom. It's actually, Novavax is an American company. It's a 2-shot vaccine that can be kept in refrigerators. We know that the Moderna and the Pfizer are mRNA vaccines. The Johnson & Johnson is a viral vector vaccine, and the Novavax is a protein subunit vaccine, a nanoparticle vaccine, where they take a fragment or piece of tissue of the actual virus that's actually inactivated, and they use that to stimulate an immune response. And it's still going through a lot of trials. I think it's in phase 2 or phase 3 trials to see what its effect is against Delta. Hopefully it'll be another vaccine to add to our arsenal of treatment against this COVID-19 disease.
Right. And have you heard anything further about, we're experimenting on our little babies here in South Africa on the Sinovac, aren't we?
I haven't heard much more about that. We're waiting for the trials. They said they're going to test it on about 2,500 children under the age of 18, babies, from what I understand. And
6 months old.
Yeah. Listen, I think you've got to understand something, that when they're doing this testing, it is with the consent of the parents. They're not just taking a baby and saying, you and this is a consenting adult that's giving consent for their child to be tested. So I think we've got to take away that myth of the whole thing is saying that it's it's just medical testing without consent. It's a hugely major consensual thing that's being done so that we can hopefully progress things, and the people who are having it done and their children are giving consent for it.
Right. Of course, no one asked the children, but never mind. Can you understand why we are still on the red list for the UK and the US? Does this make any sense to you?
Flabbergasted. I mean, our country, where we're doing genomic sequencing, where we've got top scientists, CRISP, all these type of things that are doing the genomic sequencing, they're picking up all these things. And I think it's because we're so good at what we're doing that we probably are. The other problem is that I think it was the end of August, Professor Tulio de Vera, he's a professor of immunology, and he spoke about the fact that there are 8.2 million HIV positive patients in South Africa who will have different types of mutations to the virus. And I think that scared a lot of people overseas into thinking that we're going to be a mutating ground for the virus. And I think that's one of the issues. But I see no reason why we should be on any red list for any country, and so much so that it's destroying our tourism, it's destroying our socioeconomic status. The fact is that anyone who has to come here from London, who goes back to London, will have to isolate for 10 days, and at their own cost of like 35 to 50,000 rand in a hotel, which they've got to pay for. So it's terrible.
All right.
Unnecessary.
Jared says, what is the probability of the fourth wave, and should people be relaxing restrictions within vaccinated family units?
So the probability of the fourth wave is high unless we increase the vaccination dramatically. The point is, though, that we're hoping that the fourth wave won't be as severe. We know from overseas that people who are vaccinated have not suffered from the fourth wave related consequences regarding needing to be hospitalized or that. And it's the unvaccinated people that have suffered dramatically. We've said for a while that you can, in inverted commas, relax with regards to vaccinated people in the community. With regards, yes, you can have them over for meals. And yes, you can take your mask off if you're obeying the 1.5 to 2 meter space in a ventilated space, ideally outside, but you still got to wear your masks in between. And you've still got to obey the non-pharmaceutical rules so we can maintain all of this. Look, we're in a far better place than we were this time last year. Okay, there's no doubt about it, and vaccinations play a huge role in it.
Trevor wants to know about rage. What is there a way to legislate? Well, that's unfortunately you aren't able to do that. And but what role should parents or teenagers, parents of teenagers play in the whole rage situation?
I mean, how much more do we need to know what happened last year at rage and how it was the catalyst of the second wave? Okay? Now we want to do rage again. And yes, some of these children might be vaccinated, some not, but we know once you introduce alcohol, once you introduce large crowds of kids, there's going to be spreading of the virus. I don't care what anybody says. This is not going to be a safe, effective mechanism for your children to be in. It's going to be a virus spreading arena, a super spreading event, and we will pay the price for this again.
There's just no way. You cannot drink, and I can't do it. You know,
in fact, the GP Consortium sent out a letter, a strongly worded letter, advising parents not to send their children on rage. And I just hope people listen to this.
I've got a 2 whiskey thing. If I have 2 whiskeys, my mask comes off. I know that. So, and I'm aware of this. I'm educated about this. And for me, it's very difficult. Now you imagine these 18-year-olds running around whichever centers they are. It is absolutely, absolutely impossible. Mandy says—
it's a disaster.
Yeah, certainly. After Yom Kippur, Israel saw a spike in positive cases in children 11 years and younger. There are children that got COVID during the first and second wave, still dealing with long COVID and other related complications. My question is, what are your thoughts on a 21-month-old traveling from Israel to Johannesburg and back again in the next few weeks, bearing in mind that there's no direct flights and she's too young to receive a COVID vaccine?
Well, you could put the 21-year-old on the Sinovac vaccine.
Yes.
I mean, you know what? Just give consent for that. Look, it's not an easy question because none of us know the immunology of a 21-month-old. But the point is that if you keep to the guidelines, if you're going to wear your mask and the family are going to wear their masks and they're going to follow the rules, then we should be okay. We know that children have a low propensity towards getting more sick with the virus. We do have the multi-inflammatory disease, which does manifest, but we know that because children have got less comorbidities and because they've got less diabetes and less obesity and because they've got less ACE2 receptors and because their immunity isn't as robust, they don't get such an immune response, these things all play a part in children not having such a bad effect. But that being said, you've got to be protective and you've got to make sure you do things according to the non-pharmaceutical interventions.
Right. And somebody asking about myocarditis from the vaccine. Is that a thing?
So we've spoken about that a few times before as well. Mm-hmm. We know that with the mRNA vaccines, this is a very rare complication of the mRNA vaccinations, especially after the second vaccine, for instance, with the Pfizer. It happens in 12 to 39-year-olds. I think there's about a 12.6 cases per million that can get the myocarditis. The risks are far outweighed by the benefits of actually getting vaccinated. We know that if you have the second vaccine, if you get chest pain or if you get certain cardiac manifestations, you need to be checked out, and it's something that is very treatable if you catch it very early. So it's not one of the reasons why you shouldn't be vaccinated with an mRNA vaccine.
Right. Okay. So that's really that's very important. I suppose one of those, it falls into the category of one of the myths that you have this happening rarely, and then it becomes a thing that people are concerned about.
100%. It's not a myth; it is a reality, but it's such a small reality that it's outweighed by the benefits of the actual vaccination.
Right. What's interesting to me is that one of the advantages of now getting out there a little bit is that you start to see people. And I'm absolutely blown away by the number of people that have come up to me to thank me and you, Dr. Anton Meyberg, for this Synthesis COVID podcast. I can't believe that how many people it's really, really resonated with. And I'm very, very grateful for it. I also think that, going back to the whole issue of mental health, it's grounded me, and I think to some extent you as well, that every week we've taken stock over the last 18 months of where we are, where it's going, where people are at. And I think that's been very, very useful and very, very helpful, certainly to me. So I just do want to thank everybody for your incredible feedback. We've also been nominated for the Jewish Achievers Award for this podcast, which is also enormously gratifying. We were looking at the numbers, and there are 353,000 views that we've had so far on these podcasts. We've done 77 of them, but it's just amazing, and definitely helped me getting some of that positive feedback. Anton, your response to that?
Yeah, I must say, it is amazing. And, people have asked me many times why I don't put it into book form or write a journal of what's been going through. But I think these 77 podcasts have in some way been a type of journal for me, a type of writing of a way that I can actually express what I've been living through and what we've been going through as sort of healthcare professionals and with families and everything that we're going through. But we highly have enjoyed doing this, and I think it's just the questions we get from people are really thought-provoking and have really helped along this journey.
We are going to be taking a break next week. We're going to give Dr. Anton Meyberg 1 week off for the Jewish holidays. We'll let him sleep in next week Sunday. So we aren't going to have a podcast next week Sunday, but we will be back the week after that. Is there good news?
So there's great news. Okay, the numbers are down. All the provinces are over the peak. The vaccination rates are increased. 7.8 million fully vaccinated people in the country, which is 19%, a total dose of 15.9 million vaccinations. And of course, on top of the log, Liverpool. I mean, who could think that, we've got our own group of young boys that are still winning the games for us. We're winning. We had a great week against AC Milan, a great week against Leeds. And just, you'll never walk alone. And my quote is on how anti-vaxxers do statistics. And it goes as follows. If you have 4 pencils and I have 7 apples, how many pancakes will fit on the roof? And the answer is purple, because aliens don't wear hats. Wishing you a good week, wishing you a safe week, well over the holidays, be safe, and don't forget the rules.
All right, so there we go. That's something to think about or not. Either way, this has been a Sunday Synthesis podcast with me, Howard Feldman, and of course, Dr. Anton Meyberg. Thank you for all of your questions. Thank you for subscribing below if you haven't already done that. And we'll see you in 2 weeks' time. Have a great week, and God bless.